Thank you, Dr. McCanowitz. Our second speaker is Dr. Jonathan Buonocore. Dr. Buonocore is a research scientist at the Center for Climate Health and Global Environment at the Harvard T.H. Chan School of Public Health. He evaluates the health, environmental, and climate benefits and impacts of energy choices and climate change mitigation methods. Currently, he is researching air pollution from oil and gas development in the United States, climate policies for the transportation sector in the Northeast U.S., building electrification, and possible health impacts of stratospheric aerosol injection, which is an intervention intended to mitigate climate change by reflecting sunlight. Previously, he has evaluated the health co-benefits of a number of climate policies, including options for nationwide power plant carbon standards in the United States, a carbon price in Massachusetts, and an expansion of onshore and offshore wind energy, solar energy, and energy efficiency programs in the US. He has also applied these methods to financial investment portfolios, green buildings, forest fires in Indonesia, and worked on health impact assessments of transportation policies in the greater Boston area. So please welcome Dr. Buonocore.
All right, so thanks everybody for coming. And thanks to you all for hosting and kind of inviting us here today. I wanted to talk a little bit about two different papers that we're working on at the moment. The we in question here is a team led by myself, a group of folks at the University of North Carolina, a group of folks from Environmental Defense Fund, and as Drew before me mentioned, he's part of this team as well. And this is a large kind of multi-pronged project that is looking at the health impacts of the oil and gas production, and eventually going to look at the health benefits of some different policies. So just to give a quick overview of what we're going to talk about today, first talk a little bit about this new framework for assessing the health impacts of oil and gas along with these other sectors. I'll give some results for the full health impacts of oil and gas production in 2016, and same thing for production in the Permian Basin. This is the oil and gas producing region in West Texas and Southeast New Mexico. So just to give a quick overview of how this framework works, there's kind of three modules here that starts with gathering your emissions data, doing the air pollution modeling, and then doing the health impact assessment. For this, and what I'm going to show today, we're looking at the 2016 baseline from the Environmental Protection Agency here, looking at that nationwide, and then subsetting out the contribution of the Permian Basin in West Texas. We take these results and run it through the community multi-scale air quality model version 5.2.1. This is a really highly advanced air pollution fate and transport model that simulates air pollution on a 12 kilometer by 12 kilometer grid throughout the United States on an hourly basis using hourly meteorology data. So it's basically weather forecasting, computational power, and 200 pages of chemistry running hourly across the nation. So it's a very, very large kind of computational load. And then the last component of this is doing the health impact assessment. And to do this, I built a platform called BenMapper. For those of you who are familiar with EPA's BenMap, it's fairly similar logic to that, but it has some different advancements to it, including more up-to-date population data, more downscaled population data, and just more flexibility to add more things. So to this, I've added a few new health outcomes and added the ability to model the health impacts of nitrogen dioxide, which is a pollutant that is fairly common in emitted from combustion. It contributes to PM2.5 and ozone, which has been captured by previous models, but the ability to capture the direct exposure to NO2 before it turns into PM2.5 or ozone is new here. And to give a little bit more detail how this health impact assessment works, basically you take the air pollution data from CMAQ. So this is again a 12 kilometer by 12 kilometer grid of the United States, surface level air pollution concentrations. Basically overlay that with population data. Here we used the 2018 American Community Survey. When we did the study, the census was not complete. We merged that with background health data. So here we have data from the US CDC on mortality and morbidity, along with a few other sources here. There are some states that provide data on some other outcomes here. We then merge this with, once we get the air pollution, the population, and the background health data merged together, we then model the health impacts of these changes in air pollution using what's called concentration response functions. So these are from the epidemiological literature. These are basically measurements from studies that have followed a lot of people over a long time. And the studies have basically figured out for a given a given increase in air pollution, what happens to the chances of something bad happening to you in the future. So we have basically increase in air pollution. What does that do to your risk of asthma, death, heart attack, respiratory hospitalization, on down the line for these different health outcomes. So with this framework, we're able to model 3 pollutants rather than the standard 2. We have a little over 10 health outcomes, and we're able to do everything at county resolution. So right now, again, the platform currently includes fine particulate matter, ozone, and NO2. We can expand it to other pollutants. And I guess kind of to preface this compared to other research that you may have seen, one of the advantages of this platform is it gives you tells you the impacts in the location where they are occurring rather than mapping them back to the source region. And for a lot of the models that are out there, it's much more common that they will map the total impacts of emissions from a source rather than where the impacts are occurring. There's, again, over a dozen health outcomes here, and using CMAQ, it's a regulatory grade model, so meaning it's used by the EPA for regulatory impact assessment, and along with that, it's capable of modeling compliance or non-compliance with the National Ambient Air Quality Standards. So starting on down the pathway here, this is what oil and gas production in 2016 contributed to the 3 air pollutants that we're modeling here. You can see PM 2.5 in the lower left, ozone in the upper right, and NO2 in the lower right. So there's a lot of differences in terms of which pollutants are increasing where and kind of what the spatial scale of things. Ozone is the most widespread, and it's really focused on Texas, Oklahoma, and Kansas. And you can see it kind of spreads into Louisiana and Mississippi as well, with a little bit in Colorado. PM 2.5 is a little bit more spatially focused, but you see, again, there's this large increase in kind of the lower Great Plains and a fairly strong increase in Colorado, but there's less of a spread nationwide as there is for ozone. And NO2 is even more concentrated in the oil and gas producing areas. So you can really clearly see the areas in Texas, Oklahoma, Kansas. You can see the Marcellus in Pennsylvania sticking out, the Bakken in North Dakota really sticking out, and the few areas that are producing oil and gas around California. So this is the air pollution. And I should mention here also, again, for the exceedances, there's 634 exceedances. These are one grid cell that's over the daily ozone. There's 634 of those, and for PM 2.5, there's 1 exceedance of the annual and 29 exceedances of the daily National Ambient Air Quality Standard that are due to oil and gas pollution, or could go away if oil and gas pollution was completely removed. So looking at the 2016 health impacts, this is again mapping the air pollution data you saw earlier on top of population data and background health data. You can see that there's some fairly large health impact here. There's between 4,500 and 12,000 deaths, 410,000 asthma exacerbations, really between 9,200 and 810,000, and between 830 to 3,200 new asthma cases. And one thing that I really want to point out here is the spatial extent of the health impact. So you can see that there's health impacts in the areas that experience a fair amount of oil and gas pollution. So you can see the cities in Texas, Oklahoma, Colorado, and Southern California really sticking out, along with Pittsburgh. But you can also see some cities where there's not a lot of oil and gas pollution also sticking out, meaning they're getting impacted by oil and gas pollution. So these are areas like Boston, where I am, New York City, Philadelphia, DC, Orlando and Miami, Phoenix, Arizona, and Chicago and Detroit, all of which they're fairly far away from oil and gas pollution, but they're getting affected by they're far away from the production, but they're still affected by the pollution, kind of demonstrating the degree of the regional spread of the air pollution from oil and gas. And this trend is kind of consistent across asthma exacerbations, new asthma cases, and deaths due to air pollution. So in total, this is what the total health impacts look like here, looking across a subset of the health outcomes that we modeled. Grand total health impacts is between 27 billion with a B and 170 billion with a B dollars worth of health impact, largely driven by deaths, just because the value of those is so high. And again, just to kind of reiterate with the cities, there's really a lot of health impacts across different cities. A lot of cities, you can see they're listed, are close to oil and gas production and are heavily affected, but there's a lot of cities that are far away from oil and gas pollution or oil and gas production that are affected by the pollution as well. So similar story with the Permian here. So this model just isolates the effect of the Permian. So you can see the same three pollutants being modeled here. You can see this really big spread of ozone, this more modest spread of PM 2.5, and this fairly kind of geographically focused impact of NO2, mostly focused on West Texas. So doing the same procedure to figure out the health impacts, you can see that there's, again, most of the health impacts are focused around the Permian Basin, with the cities in West Texas and Southeast New Mexico being the most heavily impacted. But you're still getting some impacts areas far away like Chicago, Pittsburgh, New York City even, and here in Boston, getting affected by pollution from the Permian. And if you zoom into Texas here, you can see in the upper right that there's a lot of asthma. This is a lot of asthma attacks in children that are occurring within West Texas here. Oops. There's the right map. So again, this is normalized to population. So kind of taking population out of the picture here, looking at it kind of per person. I think most notable here is looking at West Texas exclusively. You can see that there's basically 6 asthma attacks per 100 kids due to air pollution in the Permian Basin. And this is roughly doubles the baseline asthma that you'd expect to see in Texas. So totaling up the impacts of what's going on in the Permian, basically we found that a little over half of the total impact occurs out of state. The most heavily impacted state is Texas, followed by New Mexico, but then after that it's Oklahoma, Illinois, and Kansas. So again, there's focusing on deaths. There's about 300 deaths nationwide, with about 130 of those happening in Texas. And looking at asthma exacerbations, there's about 10,000 in total, with about 7,300 of those happening in Texas. And most of the reason why the proportions work out the way they do, where there's more deaths happening outside of Texas, but more asthma exacerbations happening inside of Texas, is because of this role of NO2, where it's a strong contributor to asthma, but it's more spatially focused in Texas. So you're going to see more of the impact of NO2 happening within Texas. Oops. So just going through the main findings here, again, there's a large and widespread health impact from oil and gas production. There's areas that are far away from oil and gas production that are getting pretty substantially impacted. An example of the Permian, it's the air pollution from that is making it all the way to Chicago, making it the fourth most impacted state. Again, 7,500 deaths, 410,000 asthma attacks, about 77 billion in total health impacts. It's likely to be the case that the highest impact processes are combustion relating, since NO2 was the strongest contributing pollutant to the total health impact. And this new platform here, it's a pretty substantial step forward in terms of air pollution and public health impact assessment methods, since it gives us the ability to track air pollution from sources to the exposed populations. We have the ability to include these new health outcomes, and we have the ability to include NO2, which Again, it's over a third of the deaths and over 85% of the asthma attacks here. For future work, we do want to use this model to look at the effects of the methane rule, potential regulations on flaring and other components of the oil and gas production. Look at the rest of the life cycle of gas, really look at the complex interaction that exists between VOC emissions that get emitted alongside methane and PM 2.5 formation, and then try and implement a more elaborate tracking mechanism to track impacts of individual states and individual sectors. So with that, I just want to say thanks to High Tide and Environmental Defense Fund, who provided some of the financial support for this, to Allison Eighth and Jeffrey Vukovic at the EPA for helping out to put together the emissions inventory, and to a team at Columbia University, Dr. Ricky Pereira and Alek Berberian, who's now at UCLA, for helping to put together the children's health outcomes. So thank you.